All right, Dr. John Torres here with NBC News, and today on my Doc to Doc series, where we look at coronavirus issues around the world, I bring in medical experts to help me talk about this in a very casual way, just to get the information out to everybody. And particularly this time, we're talking about something that you might not have heard of, but more than likely you'll be hearing about it more and more as time goes on, mainly because it takes time for this condition to become apparent. And it's a group that calls themselves the long haulers. And to help me with this, Dr. Natalie Lambert. She's from the University of Indiana. She's the Indiana University School of Medicine. She conducts health informatics and behavioral research. And so, Natalie, thank you for being here. First and foremost, I appreciate it.
Thanks for having me.
Explain me that word, long haulers. What does that mean?
Well, it's a term that some patients have adopted themselves to describe the experience that they're having with COVID, which is that many weeks and even many months after first getting sick with COVID-19, they're still having these long-term symptoms.
And I think a lot of people think, okay, COVID-19, we always talk about 35 to 50% of people don't have symptoms. Then the rest of them are mild to moderate symptoms for the most part. And then there's that small percentage that has severe symptoms. And unfortunately, some die from it. Are we talking about people having these long-term symptoms who are mostly those moderate to severe people?
Yes, I would say our understanding of what a moderate to severe case is sort of evolving over time. I think the original story that we heard was that you either have no symptoms or you had a risk that you could get very sick and end up in the hospital. But really there's this very large group of people in the middle who get actually quite sick, not quite sick enough to be hospitalized, but have symptoms that make it so they can't function like normal. And for quite a few of those people, those symptoms last for a very long time.
And with coronavirus, the symptoms we normally talk about: fever, cough, muscle ache, shortness of breath, belly pain, loss of smell. I mean, the list goes on and on. With long haulers, are their symptoms different, especially as time goes on?
Well, yes. And that's the result of a survey that Survivor Corps and I recently posted in their Facebook group. And what we found is that certainly the long-term symptoms include some of those flu-like symptoms like fatigue and muscle aches, but the other things that linger for a long time are more related to the nervous system or the entire body. So things like difficulty concentrating, difficulty sleeping, memory problems, dizziness, joint pain, different types of heart problems as well.
What got you interested in this?
Well, what I do for my job, and I love my job, is that my job is to really understand what sick people are going through. So if someone is ill and they need information and they're going online, what I want to know is, why are they going online to get health information? So I've done this with women who were just diagnosed with breast cancer. I've gone to online forums to see what they're talking about. And then when COVID hit, since so little was known about the disease, I knew that patients would be going online. So that's where I found the Survivor Corps Facebook group. And they already have well over 90,000 members, and these people have been posting for months. They have almost 1 million posts. So that's a lot of really great data about what people have been experiencing with COVID.
So these are 90,000 people that have joined this group that are saying, I still have symptoms from coronavirus that I had a couple months ago.
Well, not everyone has long-term symptoms, but I will say that the people who are posting regularly in the group, it's often people with long-term symptoms who are trying to get advice or try to figure out what's worked for other people.
And when you look at what's going on there, obviously this is utilizing the power of the internet, Google, Facebook, Twitter, all the different social media aspects of this. How did they end up starting all this? And how did the name Long Haulers come about?
Sure. Well, Diana Berendt is the person who started the Facebook group. She was one of the first people to get sick in New York City. So when she was at home in quarantine, she did the most productive thing that someone could ever do in quarantine, which was starting this grassroots movement to try to connect people. And I'm not sure exactly where the long haul name came from. That's the thing about the internet, is that it's hard to track down, who came up with any idea. But I will say that it stuck very fast, because the idea that this coronavirus could be like a flu that might hit you hard for a couple of weeks, many people found that that was not the case. So, yeah.
When you start looking at this, when you start looking at the data and talking to different people that are part of this group, what's surprising you the most about all this?
Well, I will say,
just the sheer numbers, or?
Well, there's some things that don't surprise me. So I do a lot of my research online, listening to patients, and I've seen a lot of common patterns with what's happening with COVID and what happens with other disease, whether they're rare diseases and people need information, or things like breast cancer. And it's that people are incredible at supporting each other and sharing really good information. But what surprises me the most is how many thousands of people are crowdsourcing data together to try to come up with solutions. That's a little bit unprecedented to me.
And this has all been of recent, the coronavirus, and the reason I'm asking a question, we started first hearing about this February timeframe. When did this come about where you started looking at what's going on in the internet, what people are looking for, and kind of getting this confluence of people with symptoms saying, okay, I might have this long hauler syndrome?
Well, I was searching online pretty much since January, trying to track down different stories, but I know that the Survivor Corps Facebook group started in March, and the membership, it increased very, very quickly. So I would say that people were talking online since the beginning of the year. But even now, every time more people have a loved one who's gotten sick with COVID and not gotten better, more people are finding these online spaces like Survivor Corps.
And you did a survey that reported 98 different symptoms in these people. What were the common ones? And what ones surprised you?
Sure. So the most common ones, there were some flu-like symptoms like fatigue, difficulty breathing. We know those are very common, right. But the fact that those could last for months is pretty surprising. Other things that surprised me were how much the nervous system seems to be impacted, because we're starting to get more research about that out there, but I haven't heard, talking to just GPs, I haven't heard that talked about very much. So the fact that people could have trouble with their memory or difficulty concentrating, or even having blurry vision was something that surprised me. Also, hair loss has gotten a lot of media coverage in the Survivor Corps group. Even, a month ago, you would see pictures people posted with very large chunks of hair that they had lost.
And so you were seeing that online before it was coming out in the media?
Always. Even COVID toes, that was being talked about in the Survivor Corps group at least a month before it had hit the media news.
And are there any symptoms out there that you see that people are complaining about on a fairly regular basis that the media is not talking about?
There are always new things coming up. And it's interesting is that it seems to happen in waves where people who were sick starting in February or March, we're starting to see some new symptoms arising. And this is more anecdotal. We haven't done in-depth research on this yet, but I'm working on it. We can talk about that. But I would say vision problems, so people having blurry vision or even their vision worsening and needing stronger glasses has been something I think we need to talk more about. And ear pain has started to be a problem as well.
Well, let me ask you this. Being an expert in health informatics, are we missing the boat a little bit, those of us in the public health and the medical community, by not using health informatics to the point where, are we not leveraging a tool that we have out there?
Well, let me put it this way. I think, I'm a data science person, so I'm always going to be in favor of a data science approach. But I think we need both approaches, where we need to do what I'm doing with these online patient groups, where we look at things very broadly. So in the survey that we posted, I asked, please tell us any long-term symptom that you're experiencing. And I created a list where I mined the information from the group. But I said, if something is missing, please add it. And then people who come afterwards can vote on that symptom. So I think we need to start out really open-ended with patients' experiences just to get an understanding of the lay of the land for the disease. And then after that, we need people who develop medical therapies to focus in on those.
That's great. One of the issues often is, especially when people start having long-term symptoms, it takes a while for the medical community to realize that these might be actual physical symptoms or symptoms that are of concern. Are you seeing that in what you're seeing online, what you're hearing from people, that my doctor's listening to me or my doctor's not listening to me? What do you find there?
Well, I've heard both, but what I've heard a lot more of is that patients are having a hard time convincing their primary care doctors that things like heart palpitations they're having 2 months later are in fact related to COVID. There's been a lot of reports of their doctors saying, well, I think that's just pandemic anxiety, and maybe go home and get some more rest. Where in reality, there's recent research showing that the heart can be severely impacted by COVID, and they might need heart medication to control those symptoms.
So, and this is kind of the side question to this. What would you tell people who go to their doctor and say, I think my heart palpitations are part of my COVID issue, and the doctor blows them off to a certain extent? What would you tell them? How would you advise them about going forward with that?
Well, I think they're in the situation that a lot of patients are in when not much is known about a disease and they need to become their own advocate. So I would say download the white paper that I posted. That's on the Survivor Corps website, and I'm going to have it on the Indiana University website soon too. But, download the studies that are coming out if you can and show that to your doctor. But if your doctor still doesn't believe you, there are these post-COVID recovery care centers that are starting to open up, and they will be very aware of these types of problems. So it's sad that I'm telling patients you just have to advocate for themselves, but I think it's also people like me helping to educate doctors who don't see patients in the thousands with COVID. They might only have 100 or so, whereas I have the benefit of talking to, tens of thousands of people about these things.
Exactly. And I know as a physician, I can tell you that often, when patients come in and it's something you've not heard of, your inclination is to go to things that you've commonly heard of over the past few years and say, well, it's probably attributed to that. Let's go ahead and look at that and other things. But if a patient brings to me a study or some other indications from a reliable source that this is something that is possible, then that certainly gets my attention of, okay, we really need to look into this. So you bring up a great point of going to their physicians with information and saying, I'm not the only one that's really feeling this way or thinking this. Others are, including in your own community. So can we look deeper into it? That's great advice. Is there anything that signifies why these people are getting this kind of issue of their pre-existing conditions? They tend to be older, or is it just sort of a random occurrence?
We cannot answer that question yet, and that's a really difficult thing. However, I have designed a survey that's meant to help answer that. So I've just gotten approval on a survey I've written.
Congratulations.
That's exciting. Thank you. That's one of the biggest pieces, is making sure you've done everything properly to protect people's privacy and all that. But in this survey, I'll be asking people not just about their symptoms, but some of their background health information, underlying medical conditions, and how has their experience been reaching out for medical care for COVID? So I'm hoping that lots of people take it so we can answer that.
And if people do want to take that, how do they access that?
They can go to the Survivor Corps website. So if you just Google Survivor Corps, it will pop up, or the Survivor Corps Facebook group. I'll also be posting it on the Indiana University School of Medicine website.
And again, we talked about this a little bit. Looking at it overall in a huge context, you'd never heard of the long haulers or these long haul symptoms or syndromes 3 months ago, correct?
Correct.
Right.
Yeah. Mm-hmm.
In this last interim period, when you've been looking into this, what has both surprised you and encouraged you the most about what you're hearing from the folks that are involved in all this?
Sure. Well, what's really encouraging that is that there are starting to be stories posted in the Facebook groups about people who feel like they're making a full recovery. So it's showing that some people who had long-term symptoms several months later, some of them are recovering. And there's a theme of a lot of pictures of people on the top of mountains. So climbing to the top of a mountain seems to be a symbolic way to show that you've kicked it.
Right.
But I think another surprising thing is that for COVID in particular, this makes it hard, I think, when you're talking to your doctor, the symptoms shift very dramatically. And they also come and go. So you might be having GI issues for several weeks and they'll go away and you think, great, I'm over that, no problem. And then a couple of weeks later, they come back. So it's just like, it's not like you're sick and you get better. It's very hard to tell what's going on.
And are you seeing indications too that people have recovered completely from COVID-19? They have, they had mild symptoms, moderate symptoms, they got better, things are great for a few weeks, and then all of a sudden they start getting this? Or is it kind of a continuum where they never completely got better and then they started getting more symptoms on top of that?
Well, in the posts that people have been making, I've seen both. So I've seen where people felt like they were recovered and then a couple weeks later, and we don't know, it could be tied to things like exertion or, we just don't know, that there could have been some factor that triggered it to kind of flare up again, the symptoms to flare up. So I've seen some people who made a complete recovery, and then I've had some people where they have several symptoms and one of them gets better, but then it comes back again later.
And for people listening to this, we've talked about, the people that are hospitalized, the people that had severe symptoms. What if somebody have you seen any cases where somebody had absolutely no symptoms? They tested positive for COVID, things were fine, and then weeks later they started developing things. So is it just people on the more moderate, severe side of the spectrum, or even people on the asymptomatic, no symptoms side of the spectrum that get these long hauler symptoms?
I have seen some cases where it was perhaps a young person who felt like it was just the typical cold type symptoms, but then several weeks later, they're having something like really bad GI issues, and they don't initially make the connection that it could have been related to COVID. They thought maybe it was something else. But what's really difficult is that for every person, the symptoms that they get and when they show up and all that, right now it seems, just nonsensical. Like we can't figure out why, or why some young people seem to be fine, but other young people are completely debilitated by the disease. So we really have to do more research on that.
And overall, looking at bottom lines, what's your message to people about COVID? What do you want them to understand?
I want them to know that we need to start telling the story differently about how it affects people. It's not that you either are hospitalized if you're older or having underlying conditions, or that you don't get any symptoms at all. Just that there's also a very good chance that if you get it, and according to the CDC, it was 1 in 3 people they talked to, that you could end up with these very long-term symptoms that we don't know how to cure yet. So it's just another thing to consider when you're thinking about your exposure and different risks you're taking.
And again, Natalie, thank you so much. And congratulations on getting the approval for the study that you said starts tomorrow, correct?
Either tomorrow or the next day. We have to test it to make sure there's no kinks, but I think by the weekend we'll have it live, so they can definitely go to the Survivor Corps website and check it out and take it if you have COVID symptoms.
Excellent. So again, you can go to Survivor Corps website over the next couple of days. Just keep watching. It'll eventually get active at some point, and then you can help progress something that most of us haven't heard of in this long hauler syndrome. What's happening with people over the long term. And the truth of the matter is, we don't know what long-term symptoms are going to be with coronavirus. So this is helping us in the medical community find that out as well, because as we know, this pandemic is going to be with us for a while, and the repercussions from the pandemic, including how it affects people, those issues are going to be with us for a while too. So we definitely need to get a good handle on this. But Natalie, again, Dr. Natalie Lambert, Associate Professor of Medicine at the Indiana University School of Medicine, Health Informatics Specialist. Thank you very much. I appreciate your time and appreciate you being here with us.
Thanks for having me.
Very informative. Thank you.